S.
I don't know what it's like to live without knee pain. I've had knee pain for 15 years. I had a realization not long before Zoe was born. I just realized that I live with knee pain every day. That is my normal. I don't know what it's like to have a pain level of 0 out of 10. My initial injury, I was playing soccer and I actually broke my femur, and my long-term chronic knee pain has stemmed from that injury. My quality of life could have more fulfillment. I really had to compensate. I had to change my everyday life. Chasing Zoe up and down stairs is a nightmare for me. It's okay to chase her up the stairs, but coming back down, my knee doesn't like coming downstairs very much. I have a very large dog who likes to run. I would love to be able to run him, but I can't. If I were to run the dogs, it just puts so much stress on my knee that it will hurt later. So I started CrossFit 8 years ago. It's my outlet. CrossFit is a combination of high intensity exercises, a wide variety of different types of movements at different speeds. Since I started CrossFit, I continued to have pain. It's been progressive worsening. I like to be able to lift heavy weight from full range of motion. Some of the lifting that you do, you catch it deep in a squat, and squatting, it just doesn't feel good. Instead of being able to go all the way to the bottom, like I really want to, and like everybody else does, I squat to a bench. I stop at about 90 degrees. It helps protect my knee a little bit. I put all my weight in my left side. My options, I assumed, were very few as far as my knee pain is concerned. And then in 2017, it had become constant enough that, and I had started working for an orthopedic surgeon and realized that there are other options out there for me, like MACI.
Come up straight. On examination, she has marked patellar apprehension. She's had multiple patellar dislocations. Unfortunately, that did result in significant cartilage damage over time. And so now she's left with not only a patella instability issue, but also a cartilage problem. We're going to do a realignment and ligament reconstruction to help with the patellar instability issue, and then use MACI to resurface the cartilage. MACI is used for treatment of symptomatic cartilage defects. It's made of your own cells, which are populated onto a membrane and then implanted into the body that subsequently absorbs the membrane.
It's my own cells. It's my own body. I trust my own body. What appealed about the MACI procedure to me is I've seen it firsthand. Working in orthopedics as a physician assistant, I've seen how patients recover. I've seen the quality of life they get back, and I've seen how well the cartilage cells have proliferated. I have seen this patient go from, I can't play in the floor with my kids, to I can kick a soccer ball in the backyard with my kids, and I want that for myself. So that is what appeals to me. After I have the MACI procedure, I look forward to going for a run or for a bike ride. I look forward to having a little bit better quality of life and be able to do more of the things that I love.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is made up of your own autologous cells that are expanded and placed onto a film that is implanted into the area of the cartilage damage and absorbed back into your own tissue. MACI is used for the repair of symptomatic cartilage damage of the adult knee. The amount of MACI applied depends on the size of the cartilage damage. The MACI film is trimmed by your surgeon to match the size and shape of the damage to ensure the damaged area is completely covered. Limitations of use: it is not known whether MACI is effective in joints other than the knee. It is not known whether MACI is safe or effective in patients over the age of 55 years. Important safety information: MACI should not be used if you are allergic to antibiotics such as gentamicin or materials that come from cow, pig, or ox, have severe osteoarthritis of the knee, other severe inflammatory conditions, infections or inflammation in the bone joint and other surrounding tissue, or blood clotting conditions, have had knee surgery in the past 6 months, not including surgery for obtaining a cartilage biopsy or a surgical procedure to prepare your knee for a MACI implant, or cannot follow a doctor-prescribed rehabilitation program after your surgery. Consult your doctor if you have cancer in the area of the cartilage biopsy or implant, as the safety of MACI is not known in those cases. Conditions that existed before your surgery, including meniscus tears, joint or ligament instability, or alignment problems, should be evaluated and treated before or at the same time as the MACI implant. MACI is not recommended if you are pregnant. MACI has not been studied in patients younger than 18 or over 55 years of age. Common side effects include joint pain, tendinitis, back pain, joint swelling, and joint effusion. More serious side effects include joint pain, cartilage or meniscus injury, treatment failure, and osteoarthritis. For more information, please see full prescribing information at MACI.com.